This afternoon, President Trump hosted a celebratory event to sign the One Big Beautiful Bill Act.
The golden age of America is upon us. We are in the golden age. It's going to be a period of time, the likes of which I don't think this country has ever experienced before. We're going to make America great again, and it's happening very fast.
The House narrowly passed the bill last night, with everyone in Colorado's delegation voting along party lines. The sweeping domestic policy bill includes permanently increasing the child tax credit to $2,200. It also allows tipped workers to deduct tips and overtime from their federal taxes. It drastically increases funding for U.S. Immigration and Customs Enforcement and eliminates tax incentives for clean energy, electric vehicles, and energy-efficient programs.
The legislation also includes tougher restrictions on Medicaid, which provides government-sponsored health care for low-income and disabled Americans.
It scares me, not only for myself, but for all of the people who are on Medicaid, who are just trying to survive.
Lindsay Schoen says she doesn't know where her life would be if she didn't gain access to Medicaid back in 2014.
Like most people, I'm on Medicaid because life has dealt me a rotten hand, and I got sick with a rare bacterial systemic infection that got bad enough that I couldn't work. And so when my COBRA benefits ran out, I was able to get onto Medicaid.
Being on Medicaid not only helped her afford countless hospital visits over the years, but it also gave her purpose again.
Because of Medicaid, I've been able to get well enough to actually work again. And I can't work a lot. I was able to start working again in 2017. And I love my job so much. I work for the state of Colorado for the Division of Youth Services.
President Trump's tax cuts and spending legislation, dubbed the One Big Beautiful Bill Act, includes restrictions on Medicaid. 1 in 4 Coloradans receive Medicaid benefits, and the executive director of the state's program says the bill is anticipated to result in the large-scale loss of health insurance coverage for Coloradans.
What this bill does is really shift the financial burdens, or allow for federal savings to come through Medicaid by shifting the financial burden to states.
Annie Lee is the president of Colorado Access, which works on behalf of the state to ensure communities have access to health care coverage like Medicaid. She says there are still many uncertainties, like the increased costs for the state and determining who will receive care moving forward.
The majority of the things in the bill that was just passed are set to take effect next year, the following year. There's kind of a graduated impact for most of the things in the bill.
I just feel like the people who we've elected to be our proxies have just turned around and pushed us off a cliff, and there's no safety net down there.
The bill adds work requirements for certain adults to keep using Medicaid. Supporters say the requirement will encourage able-bodied adults to improve their lives and be more productive.
A lot of us do work. We try really hard. We don't just lie around on the couch all day.
Lindsay says she worries how her treatment options will change if she loses Medicaid.
I was hospitalized 7 times last year, and I had 2 surgeries, and I worked the entire time. But there were and are many times where it just feels like I'm walking on thin ice. If one more thing happens, the whole house of cards could just collapse.